Hello everyone and welcome to our channel PhysioSaurus. In this video I am going to talk about the ankle complex. This is my first video on the ankle complex series. So this video is introductory, but I will also talk about the motions of the ankle complex. Okay, so watch this video till the end. A small disclaimer before I start this video, pause this video right now and take out your pen and a paper and note down all the important highlights of this video. It would be even better if you will have Cynthia Norkin's biomechanics book with yourself right now. Okay, so now I will start the video. So ankle complex is somewhat structure of the ankle complex is somewhat similar to the wrist or the hand complex. So this is why it is structurally analogous to the wrist complex, because in the wrist, if you will see, there are 8 carpal bones, but in the ankles there are 7 tarsal bone. In the wrist there are 5 metacarpals and in the ankle there are 5 metatarsal. So this is why they both are structurally analogous to each other. During the weight bearing activities are for example such as running, jogging, jumping, walking. These are all the weight bearing activities. So during the weight bearing activities, your foot undergoes through a hell lot of stress. Okay, so and when it crosses your threshold value, there would be a chance of having ankle injury. Okay, so during the weight bearing activities, foot undergoes through a lot of stress. Foot also provides an adequate base of support and function while walking, running, jumping, etc. Base of support, what does base of support means? So let's talk about the base of support with an example, such as let's say this person is here standing. We'll draw on another diagram. Let's say this person is sleeping here on the mat. Let's say this person is sitting in a chair. Okay, this is his hands and this is the chair. If you will see this diagram, all 3 diagrams little closely, the base of support is the area which is occupied by a body when they are into some certain position, such as when they are standing, the area covered is this much. Okay, so this will be the base of support. If they are sleeping, the area covered by the body is this huge, so base of support is here the bigger. Okay, but if they are sitting in a chair, the base of support will be from here to here. So the maximum base of support is during the sleeping, but the minimum base of support is during standing. And if you will stand on one foot, there would be even smaller base of support. Okay, so and the larger the base of support will be, there is a reduced risk of falling injury. Okay, so foot provides an adequate base of support, because if you will see the end of the foot is somewhat if you will see, it is flat. Okay, it's not like this, it's not like a pole, it is flat like this. Okay, so this will give a larger surface area to get contact with the ground. That means it will give you a little bit more base of support, and that will help you while walking, running, jumping. Okay, now foot also acts as the shock absorber as the foot hits the ground. Okay, now the ankle complex or the foot complex, it has 28 bones but has 25 different joints. We'll learn about the joints in the upcoming videos, but in this video I am going to talk only about the joint name. Okay, but this is just setting up the stage. We will talk about all these joints particularly one by one in my upcoming videos. But if you have a pen and a paper with yourself right now, just write down all these joints name. Those are very, very important. First one is proximal tibiofibular joint. Second is distal tibiofibular joint. Third one is talocrural or the ankle joint. Fourth one is talocalcaneal, which is the subtalar joint. Fifth one is the talonavicular and calcaneocuboid joint, which is also known as the transverse tarsal joint. Okay, The sixth one is tarsometatarsal joint, which is the 5 in number. Then there are metatarsophalangeal joint, these are also 5 in number, okay. And then there are 9 IP joint, which is the interphalangeal joint, which are 9 in number, okay. So if you will count here all these joints, you will see that there are 25 joints, okay. Now let's get a little bit deeper. So the bones of the foot in the ankle complex, they are divided into 3 segments: posterior segment, middle segment, anterior segment, okay, which is also known as hindfoot, midfoot and the forefoot. If you will talk about the hindfoot, it is composed of talus and the calcaneus, okay. Here, as you can see here in this diagram, this one is the talus bone and this one is the calcaneus bone. So the hindfoot covers this much area and it covers the calcaneus bone and the talus bone, which is your heel bone, okay. The second one is the midfoot. It is composed of navicular, cuboid and the 3 cuneiform bones. There are 3 cuneiform bones in each foot, okay. So if you will see here, so the midfoot, it covers this much area and this covers the navicular bone, cuneiform bone and the cuboid bone, okay. The last one is the forefoot and it is composed of the 5 metatarsal and the phalanges bone. So it is composed of this much area of the foot, okay. So this is the simple diagram of the foot, as you can see here in this video. So the last one is the forefoot, which is the anterior segment. This one is the anterior segment, this one is the anterior segment, okay. This one is the middle segment and this much area is your posterior segment, okay. So the anterior segment is composed of metatarsal and the phalanges. Now structural abnormalities in spine, pelvis, hip or knee, they can lead to altered movements between the joints. There are 25 different joints which we have already studied, okay. At least we have known all the names of the joints, okay. So if there are certain abnormalities in the spine, pelvis, hip or knee, they can lead to altered movements between these 25 joints, which can contribute to excessive stress in the foot, which can definitely lead to ankle injury or any kind of ankle conditions, okay. So this is a great point that you should keep in mind, and this point will actually help you during your clinical duties, during your hospital duties, or when you open up your own clinic. You should have in mind that any kind of abnormalities in spine, pelvis, hip or knee, so any kind of abnormalities are present there, they can actually lead to ankle injury, okay. Now let's talk about the motions of the ankle complex. Please don't forget it, this is the important topic, motion. So there are 3 different kind of motion which occurs in the ankle complex: dorsiflexion, plantar flexion, okay. Second one is the inversion with eversion. The third one is the abduction and the adduction. We will talk about it in detail, but there is a fourth movement, which is the pronation and supination, a very important movement. This is basically nothing but the it is the combination of the 2 movement, more than 2 movements. So we will talk about it too, okay. We will talk about the axis and the plane. Since it is a combination of the movement, so it will occur in a different axis, it will occur in a more than one axis. So it is multi-axial joint, multi-axial motion, okay. Now let's talk about our first movement, which is the dorsiflexion and plantar flexion. Now the dorsiflexion and or the plantar flexion, these movement occur in the sagittal plane and coronal axis. The concept of the plane and axis, I have already made a separate video on it. You will find that video on my biomechanics playlist, okay. But still, I am repeating it once again. Sagittal plane is that kind of plane which splits the body into equal right and left, okay. And the coronal axis is drawn from the right towards the left or from the left towards the right, okay. As you can see here, in this diagram. Okay, so this line here is your coronal axis, and around this axis dorsiflexion or the plantar flexion movement occurs. Okay, so this was just about the plane and the axis. If you want to learn more about the plane and axis, you will find that video in my biomechanics playlist, or just if you couldn't find the link, I'll just add the link in the description box below. Okay, now what happens in the dorsiflexion or the plantar flexion is, during plantar flexion movement, it decreases the angle between the leg and the dorsum of the foot. Okay, just see this diagram. If you will see here, while performing the dorsiflexion, this one here is the normal angle, but when the dorsiflexion has been completed, the normal angle is decreased. Okay, this one is the decreased angle and this one is the normal one. But if you will see what happens in the plantar flexion, this same angle, it increases up to here. Okay, so the angle is increased in the plantar flexion and the same angle is decreased in the dorsiflexion. And what angle are we talking about? This is the angle between the leg, which is the tibia part, and the dorsum of the foot. Dorsum of the foot means basically, if you will look at the foot, okay, so this upper surface of the foot is known as the dorsum. Okay, and this below one, this one is known as plantar surface and the dorsal surface. This is why when you move the foot in the upward direction, this is known as dorsiflexion, and when you move the foot in the downward direction towards the plantar side, that is known as plantar flexion. Okay, now this same movement, when you talk about this same movement at the toe of the foot, this same movement such as this dorsiflexion, when this dorsiflexion happens, in the dorsiflexion you move the foot in the upward direction. So in dorsiflexion there is extension of the toe, that means bringing the toes towards the superior direction or the upward direction. Okay, but in the plantar flexion, what you do, you just move the foot below towards the ground. Okay, in this plantar flexion, as you can see here in this diagram, you move the foot towards the ground. So in plantar flexion there is flexion of toe. That means you will bend this toe towards the ground, but in the dorsiflexion, as you can see here, there is extension of toe. Okay, that means you are bringing the toes towards the tibia bone, towards the lower leg. Okay, I hope you understand this concept. This is very easy, not a very difficult thing to understand. Okay, so the next movement is inversion or the eversion. Inversion or the eversion, they happens in the frontal plane around the AP axis or the longitudinal axis. This axis, it runs along the length of the foot. Let's understand it with the diagram again. So this one here is the longitudinal axis. Okay, this one here is the longitudinal axis or the AP axis. This axis serves for the inversion or the eversion movement. Okay, and as you can see here, this is the length of the foot. Okay, this one here, this is the length of the foot, and this line is drawn along the length of the foot. Okay, so this is why I have written here that the longitudinal axis is drawn along the length of the foot. Okay, and what does frontal plane do? So frontal plane divides the body into front and back, equally divided. In the inversion or the eversion, the plantar surface of the foot, now you understand what is plantar surface. Okay, plantar surface of the foot is brought towards the midline of the body. Just watch this image. You can clearly see that in inversion, the plantar surface of the foot is brought towards the midline of the body, because this is the medial side and this one is the lateral side. Okay, so if you will see here closely, midline of the body might be somewhat here. Okay, so if the plantar surface will move towards the midline, that will known as inversion. But in this second diagram, this here in eversion, as you can see here, the plantar surface of the foot is moving away from the midline, because midline is here and the movement is in complete opposite direction. So this is what happens in the inversion and eversion. I will repeat it again. In inversion, plantar surface of the foot is brought towards the midline of the body. Okay, and in eversion it is completely opposite. That means plantar surface of the foot is brought against the midline. Okay, now let's talk about our third movement, which is the abduction and adduction movement. This happens in the transverse plane and vertical axis. Transverse plane divides the body into superior and inferior half. Please don't forget about it. And if you will draw a line perpendicular to the transverse plane, that line will be known as vertical axis. Okay, so just watch this diagram. This is your vertical axis here, this line here. Okay, this line here is the vertical axis and it is perpendicular to the transverse plane, because transverse plane will be somewhat like this. Okay, so that means it is perpendicular, and this vertical axis is for abduction and adduction. Now let's understand how this movement occur. So in abduction, distal segment of the foot, now this is the distal segment of the foot. Okay, this one is the distal segment of the foot. Okay, so the distal segment of the foot will move towards the move away from the midline of the body. As you can see here in this abduction, the midline of the body will somewhat lie here between the legs. Okay, so as you can see here, it is moving away from the midline. Okay, this one is the midline of the body. It is moving away from the midline in abduction. Okay, but what's happening in the adduction is, in the adduction it is moving towards the midline. So in abduction, what's happening? The distal segment of the foot is moving away from the midline, but in adduction, the distal segment of the foot is moving towards the midline. I hope I'm being clear to all of my viewers. Now there is fourth motion, which I have said that it is a coupled motion. Okay, and the fourth motion is pronation or supination. So in pronation or supination, in the non-weight bearing position, means coupled motion of dorsiflexion, eversion and abduction. Okay, and in a non-weight bearing position, supination means coupled motion of plantar flexion, inversion and adduction. Okay, so it is a coupled motion of more than one kind of motion. Basically, pronation involves dorsiflexion, eversion, abduction, and supination involves plantar flexion, inversion and adduction. Now there are two terms which is again used in the ankle complex. These two terms are varus and valgus. We have discussed these two terms in the knee complex also, but it is somewhat different in the ankle complex. Valgus means increment of the medial angle between two bones. Now the two bones can be of anywhere. It could be in the ankle or it could be in the knee. So if it happens to the knee, we have a specific name for it, and if it happens in the ankle, we have a different name to it. We will talk about the name also. Okay, and the varum means decrease in the medial angle between two lines. So normally it is referred to the deformity, as you have already heard about the genu valgum or the genu varum. Okay, but it also refers to describe the position of the posterior calcaneus bone. Calcaneus bone is a type of tarsal bone. Okay, so it is used to describe the posterior calcaneus bone position in relation to the posterior midline of the leg. Just watch this diagram closely. This is your posterior midline of the leg, and this one here will be your calcaneus bone. Okay, so it is used to describe the posterior calcaneus position in relation to the posterior midline of the leg. For example, valgus means increased medial angle between two reference line. Now what are these two reference line? These reference line, basically the angle I am talking about is the angle between the calcaneus and the posterior leg. As you can see here in this diagram, here if the angle is less than 180 degrees, so that will be known as calcaneovalgus. Okay, so that means the medial angle is decreased here. So valgus in the ankle complex is termed as calcaneovalgus, which refers to increased medial angle. Sorry, the angle here is not decreased, the angle here is increased, because this is the posterior line of the leg and this one is the position of the calcaneus bone. I'll label the diagram here. This one is the position of calcaneus bone. Okay, calcaneus bone. Okay, and this one here is the posterior midline of foot. Okay, so as you can see here, the angle between them is more than 180 degrees. They are not totally 180 degrees to each other. The angle is more than 180 degrees. So when this angle increases, that will be termed as calcaneovalgus. Okay, but if the medial angle is decreased, that means this line here is your again position of calcaneus bone. Okay, calcaneus bone, and this one is the posterior line of foot. Okay, and as you can see here, the angle between them is less than 180 degrees. So when the medial angle is decreased between these two reference line, that will be termed as calcaneovarus. Very important point, please note it down in your copy right now, that valgus in the ankle complex is referred to calcaneovalgus, which means increased medial angle between the two reference line, and these two reference line are, the first line is the posterior midline of the foot. Okay, and the second reference line which is taken is the position of the calcaneus, which is the posterior midline of the calcaneus, you could say that. Okay, so when the angle is increased, that will be causing your calcaneovalgus, and when this angle will be decreased, that will cause your calcaneovarus. Okay, so here we have discussed the movements and the introductory part of the ankle complex. I hope you don't have any confusions left. Please keep reading your Cynthia Norkin's book, and you could ask me any question from that book. I will try to answer you. So thank you so much for watching this video.